Hello everyone, hope you are fine and doing well. Especially we are still facing coronavirus pandemic. I wish all of you and your families are fine in a good health. I'm joining you from Palestine, Gaza, during its under attack from Israel's Jewish. So I'm so sorry if my voice isn't clear due to the pumping, airstrikes and bad connection. It's my pleasure to be here today with you and talking about a critical issue which became a worldwide disease. If we could define it like this: myopia and its management. And there are a lot of amazing information today. Thanks again to the team of the World of Optometry for this event. Firstly, I want to introduce myself to all of you. I'm Doaa Ramlawi. I'm optometrist, graduated from Islamic University of Gaza, Department of Optometry. I'm holding Ministry of Health Palestinian license for optometrist 2016. I have been working as optometrist at Gaza Ophthalmic Center since 2016. Also, I have been working as optometrist at Optical Center since 2015. I'm a general member at International Myopia Institute. I have been working as a volunteer at Gaza Government Eye Hospital in Gaza. I'm a member at Palestine Academy for Science and Technology. Also, I'm a member at organization Women's for Science and Technology. I'm holding NIDA clinical trial work for year 2020. I finished many courses related to optometrist health management also. I'm interested in fields myopia, its management, public health, low vision to prevent blindness. Before starting, anyone has a question, please don't hesitate to put it in the chat and we will answer it at the end. Okay, let's start. Myopia or nearsightedness is a refractive error in which the rays of light entering to the eye parallel to the optic axis are brought to a focus in front of the retina while accommodation is relaxed. There is no accommodation. Is classified as a progressive, a chronic disease characterized by excessive elongation of the eye, risk of associated sight threatening complications and refractive error developing, and it's developing gradually or rapidly during its childhood and adolescence. We will talk about the myopia and its developing via the word. Simple refractive error can easily be corrected by glasses or contact lens, but those who have high degrees of myopia with thinning in the retina, it's too difficult to apply only these methods. So there are some risks associated with high levels of myopia. Some of these risks include cataract, myopic macular degeneration, open-angle glaucoma, retinal detachment. But both of retinal detachment and myopic macular degeneration have the strongest relationship to myopia and the longer axial length. Also, there is no safe level of myopia, which means each diopter increasing in myopia results associated by increased risk of myopic macular degeneration, approximately 2/3. How to control myopia progression? Okay, actually it's too longer project. You should be careful and doing all your best, so that there are some points you should know. Every optometrist, ophthalmologist, eye care professionals have the decision to choose to decrease the progression of myopia rather than the correct or treat visual symptoms only, which means you can correct and prevent the problem early. By increasing the outdoor activities, we can get some time before becoming myopia. And new technologies and therapies for treat myopia shows the efficient of decreasing myopia, even though you don't know anything about the new technologies. You must know about them and their success or failure for their art. Myopia tends to be global. What does it mean? The levels of myopia are not saving. It changes gradually or rapidly according to activities or environments and other elements. Increase in myopia will be noticeable in Western and Eastern citizens depending on the factors of the environment and race. Also, the prevalence of myopia has nearly doubled over the last past years for many reasons, as we will see now. Let us have a look here. The results in the graph done by Penn-Holden Vision Institute shows the effect of myopia and its prevalence between 2000 and 2050, which clearly we can see the effect will be increasing by a half of world's population, meaning significant increasing in cost caring for myopia, if we want to put that in our minds. There are some factors associated to myopia and affected on it and its management. So let your eyes open. The first one is genetic factor, meaning that if both parents are myopia, it will increase the probability of being myopic patient nearly to a half percent. Also, myopia can be classified as from birth, childhood myopia, early myopia, and adult myopia. So, lower hyperopia than age normal can indicate risk of myopia development. So, knowing these classifications will help you to choose the best type of a treatment for myopia. Also, female at a higher risk of myopia. Actually, no one know why, but I think due to the hard year working, due to the estrogen hormones, but actually no one knowing the strategy of the estrogen working. In addition to the above factors, ethnic background plays a role in myopia susceptibility, with a greater prevalence in those with Asian ethnicity, maybe due to the environmental changes or hormones changes. Myopia defocus speeds up myopia development in already myopic humans. Myopia could be caused by a failure to detect the direction of the focus rather than by mechanism exhibition and a 0-point error. Also, activities and visual environments. People who spend much time in front of screens, or children spend time in outdoor activities, risks of myopia development and the progression is significantly associated with the total time spent with all near activities. Okay, move on to the next one. The above chart here depicts the myopia prevalence in female. It was above the half by 21, which means it changes by the years. Accordingly to many changes and different activities, we can detect the real person today with the daily activities and daily using of screens and near working. Paragraph below here shows the effect of ethnic background and the race on the progression of myopia among the years, as we can see. Yes. Okay. According to the latest article published on January 2020, and this cross-sectional study was conducted in China during the to investigate the refractive changes in the and prevalence of myopia in school-aged children during the COVID-19 activities. The prevalence of myopia increased from 1.4 to 3 times in 2020 compared within the previous 5 past years. By recording the changes in spherical equivalent and prevalence of each child and compared it to 2020 and past 5 years, the spherical equivalent were shown stable within 2015 and 2019 with a slightly myopia shift. Then we can clearly see the myopic shift for children aged 6 to 8 by 2010. By 2020, there is a significant myopic shift in children aged 9 to 13 years. To conclude, which means that due to the coronavirus pandemic, due to the lockdowns, indoor activities, and the uses of screens for a long time have played a big role in the transformation of myopia in children younger age from 6 to 8 years. Children's refractive error status may be more sensitive to the environmental changes rather than children. However, the data here showed that girls had earlier development of myopia than the boys. If you want to talk about the disadvantages or limitations in this study, I will talk about them. First one, preschool aged children not included in this study. There is no hard working, there is no time spent on screens. Also, cycloplegic refraction not considered in this study. Lack of the orthokeratology history or ocular biometry data. Some of the children in this study were using orthokeratology lenses while it changed the corneal shape. So all these affect on the result. Okay, the evaluating of myopia, pre-myopia, and the necessity of evaluating them. You should consider some tips and put them in your mind. We have refractive error and axial length. Refractive error is the best way to diagnose myopia. Full eye examination routinely, monitoring full eye, accurate methods for diagnosis using cycloplegic refraction. But the axial length is the best way to monitor the progression of the eye, tracking the elongation of the eye. Any other pathological disease cause progression of the axial length. Also, peripheral refraction. Peripheral refraction, the peripheral light rays in hyperopic defocus stimulate increase in axial length. Several reports demonstrated the significant reduction of myopia progression with the treat hyperopic defocus by using orthokeratology contact lens. Okay, there are some essential important facts here. You shouldn't miss them. Okay, the table below shows the myopia progression or onset one and recommended clinical action by age and refractive status. The goal of myopia, as we know, to restrict the axial length and refraction as much as we can. 1. Diopter. Reduce in myopia reduction the probability of myopic macular degeneration approximately 40%. early myopia onset increase risks of high myopia, but you should keep early follow-up. More time spending in outdoor activities delay the onset of a progression of myopia. We will talk about it again. Move on to the treatment of myopia. Before making any decision to control myopic patient, you ought to pick up and knowing some considerations inside your mind: lifestyle and clinical concentration. Okay, as we mentioned before, myopia has been traditionally viewed as a consequence of interplay between genetic, ethnic, and environmental risk factors and many other factors. So, to reach to the safety and effectively treatment, you have to reviewing refractive error and eye growth, family history, age, and other activities also. Binocular vision also. The next stage is to detect and catch the first choice of myopic treatment. We have eyewear glasses. The easiest and simple way, safety way to create sharp vision. Wide range of eyeglasses lenses are available: single vision, bifocal, multifocal, progressive lenses. Using spectacle lenses has no side effects or a little side effects compared with the other devices such as irritation, myopic macular keratitis. But using single vision spectacle only doesn't make any significant inhibition in myopia progression. So if you want to make a decision, you just only spectacle as a solution. So you want to make a decision. It's depending on the level of myopia, age of the patients, and other factors. But if the myopia is stable, there is no any ocular disease, then use single vision spectacle. If absent of eye muscle coordination and there is a fluctuation of myopia level, using bifocal spectacle lenses. If you want to provide a free capability for reading vision and supporting the disorder's eye muscle, then give the patients multifocal spectacle lens. The second choice to treat myopia is contact lens. Contact lens with wide ranges of its materials and designs: soft, rigid, toric, multifocal designs, and such else. Contact lens provides other benefits to children and adolescents who don't enjoy or have a problem with the spectacle lenses. Also improving vision quality, confidence, sometimes by increasing social acceptance. The best one is bifocal contact lens, as we will see later. Okay. By simplest word, have a look here to this photo. The way of have multifocal contact lens provides clear vision and slow progression of myopia. The center portion of lens corrects nearsightedness so that the distance vision is clear and its focus lies directly on the retina. The outer portion of the lens added focusing power to bring the peripheral light's rays into focus into the retina. And animal studies shows that bringing light to focus in front of the retina causes the eye to the slow progression of myopia. If you prefer to choose multifocal contact lens to use, there are some important tips to reach your goals and achieve highest success. there is no significant clearly link between myopic patients and the pupil size, pupil diameter, but I think as I read, myopia progression shifts to be or to have larger pupil diameter, so it's fine to consider it when you prescribe contact lens. Good fitting for the lenses. Material of contact lenses provides good to provide good tear film. Always be positive. Don't lie on the patient. Patient whose lifestyle required mix of spectacle and contact lenses like presbyopia, the best one is a disposable contact lens. This article was published on May 2020 to investigate the influence of multifocal contact lenses with medium and high additions on short-term visual function in young, healthy adult population, but there is no clear details here. The third option to treat myopic patient is using drops atropine. Atropine used to dilate pupil for full examination of the eye. Lower dose of atropine has a little side effects compared with the high doses. However, the minimal doses reduce the myopia progression, but there is no effect on axial elongation, which means there is still a gap. But the question is, what is the optimal concentration of atropine we need to apply? Let's have a look to the Dr. Ackerman and his team worked in randomized double-masked clinical trials that looked at the efficacy of and safety of low, moderate, high doses of atropine and eye drops over the 2 years. They worked very hard to answer these following questions about the concentration of the myopia, efficacy of concentrations. The observed and final conclusion was, over 2 years of following up, the efficacy of typical 0.05% atropine was doubled that of 0.01% atropine. So it's remained as the optimal concentration among the studied atropine concentration in slowing myopia progression. Also, there is another research was published on the same reason on March 2020 by American Optometric Association. After 2 years of atropine usage with the 3 concentrations, the children ages between from 4 to 12 years with myopia of at least 1 diopter by measuring the axial length and the changes in spherical equivalent, the progression of the spherical equivalent and the changes in the axial length were at least by using 0.05% of atropine. I believe now we can determine what is the optimal concentration. There are some contraindications of using atropine, especially with people who have urgent disease, such like people with systemic disease or congenital syndromes. So we can mention the contraindication of using atropine, as we can see here, as dry mouth, fast pulses, and others. Many of these symptoms occur with more frequency as the concentration of atropine increases in higher dosage of atropine. The third one and other methodology of myopia progression is using orthokeratology lenses. Orthokeratology lens is long established treatment for myopia control working on the axial length reduction. The lens worn during the night due to its procedure, its design rigid gas permeable contact lens to reshape the cornea for correct degrees of myopia or reduce it. Why we have orthokeratology? As we said, the basic goal of it to eliminate or being free of wearing any spectacle or contact lens during the day. It's the ideal thing to be free of any optical aids, especially who works in dirty environments. The best choice for children with early myopia is prescribed ortho lenses to reduce the ongoing amount of myopia. The question is, for whom can I use orthokeratology lenses? Orthokeratology eliminates the refractive error up to 6 diopter and astigmatism to 2 cylinder for moderate myopia. However, above these degrees may be reduced but not totally correct. If we start treatment with orthokeratology before 14 years, we will get a great goals of myopia reduction we apply for it. There are some advantages of prescribing orthokeratology. First one, freedom of any optical aids such as spectacle, contact lenses, acceptable vision, no pain, it's not surgical, reversible, which means the cornea will return to its shape if you stopping using orthokeratology lenses, modifiable, which meaning that it changes in the prescription can be easily deal with it, again not surgery, no heart, slow down the increase in myopia in children, which it's the goal why we use orthokeratology. Otherwise, there are some contraindications of prescribing orthokeratology. Long-term of follow-up. You need long-term of following up to 6 months, 4 to 6 visits over 6 months. Retinal lens wear essential, or the cornea will revert to its original shape if you stopping wearing contact lenses. Its advantages and disadvantages. The degree of success is high but can't always be guaranteed. The speed of reduction in the myopia varies from one person to other person. Regarding to the instructions following. Also, OCT and corneal topography. Initial assessment appointment including full eye examination and corneal topographical scanning, but some poor countries absence of them. Also, not all optometrists working on it. Some others seeks to more effective approaches to stop progressive of myopia by shifting to surgeries such as LASIK, laser, photorefractive keratectomy. Okay, let us have a look here. If we have to make a decision to pick up the ideal right choice to treat myopic patient, the overall goal here is to give you a full understanding of each option. The first question is about the contact lens and its efficiency of a treatment, which means it's the ideal option. Why? Both of orthokeratology and multifocal contact lenses corrected ametropia and provide a good basic research evidence consistent myopia control effect when compared to a spectacle. So the first question is, does contact lens easy or possible to be considered as a choice for children? If no, they move to a spectacle as a only option to treatment myopia, with or without atropine regarding to the amount of myopia. If yes, we have to put the solution in your minds: orthokeratology lenses or multifocal contact lens. Now we have two options to apply for a treatment myopia. If I have just one type, then apply what you have. But when we have two options, be careful here. You ought to take some questions and consideration before choice the best correction. Does the patient has astigmatism over 3/4 or not? If yes, you have the decision for orthokeratology or toric multifocal contact lens to treatment the amount of astigmatism. Does the eyes suitable for orthokeratology or not? Cornea is too flat or not? If yes, use multifocal contact lens, any design, spherical toric daily disposable contact lens. If there are any safety issues, then already apply daily disposable contact lens to protect eyes and keeping it out of inflammations and irritations. But anyway, it's safe to assume that pretty much everywhere has access to a spherical and toric multifocal distance center design. We talk about the options available, but now if we will decide to apply one of them, the trick is to include and determine the binocular vision status and combine contact lens suitability with information on binocular vision status. For this case, binocular vision is normal. You can deal with orthokeratology or multifocal contact lens. If not, progressive additional spectacle lens with low dose of atropine is more effective to avoid side effects of bifocal prismatic effect. But if patient not tolerance for additional or has recent history of myopia, single vision distance spectacle is more efficient for him. If there is esophoria or changes in accommodative lag due to the near working, then you have to treat myopia with the plus lens for near work or back again to a progressive additional lens. Try to manage esophoria, which occur often when you use contact lens to provide binocular vision. Firstly, in spectacle it's easier if we are in the side safe, then use bifocal contact lens or prismatic contact lens to maintain binocular vision. Okay, we need to know some critical tips. In general, myopia or nearsighted children wearing traditional single vision glasses or contact lens still have the chance to increase in myopia approximately to 1 diopter per year. Ortho lenses expected to slow myopia progression approximately to 60%. Multifocal spherical contact lenses are expected to slow myopia about a half. And some researches suggest that its modality to slow myopia approximately to 87.5%. So we said it's the best option. Atropine drops can be expected to slow myopia progression approximately around 3/4. Anyway, you still have or you still can choose the option for you and what you have to treat your patient to reach the success and optimal treatment. Okay. There are some quick guidelines before you start your management. Every eye worker optometrist must have them in your minds. Full eye examination, visual acuity, color blindness, cycloplegic, age, family history, onset of myopia, and other. Don't miss to discuss eye disease to prevent infections such as keratitis and type of free activities to decrease the amount of myopia occurs. A dry eye evaluation in myopic patients, symptoms of dry eye related disorders can surface or be exacerbated in response to myopia control treatments or exposure to environmental risk factors. Prescribe the appropriate treatment to achieve the goal of the treatment. Using the best myopia control therapy, follow up what the cost in your mind. Good communication with parents to success in your treatment therapy. Don't lie on the patients and their parent. They should be informed of potential risks and side effects associated with myopia control treatment, especially atropine, contact lenses, and take their care and being aware and any complications. Also, you should provide critical tips and how to use devices with correct time for set at screens. For honestly and clear review, all parties, optometrists, ophthalmologists, patients, their parents also share an ethical responsibility to ensure that the option that you choose for treatment myopia control safe and effective, and that the patient understand the benefits and potential risks of such treatments. Children should be encouraged to wear their myopic correction full time. You have option to give them plays, gifts, anything, but to encourage them. Orthokeratology wear should be encouraged daily, a minimum of 8 hours overnight to achieve the main goal of corneal reshape. Multifocal spherical contact lens should be worn at a minimum during school hours and for near working at home. Parents should be informed that greater near work may increase the development of a progression of myopia, so that the child should take a break between the near work activities. Again, increasing outdoor activities time. As you can see, free activities such as playing outdoor delay the myopia progression and gives the eye its freedom and being well as much as you can. If I still have enough time, let me to put you in 2 minutes, put you in the situation here. Okay. Okay, in 2 minutes, I will put you in the reality of the situation here in Palestine, Gaza. The Israel's army forced the weaponless Palestinians in Sheikh Jarrah neighborhood to leave their homes under the pressure of murdering, arresting, and bombing. The war expanded to our city here, Gaza. We have been living for 10 days without electricity, under bombing, airstrikes, destroying infrastructure, presses, and media offices to prevent facts from being reported, and killed civilians and kids also. The night became a ghost town here. We woke up to the news of bombing of houses on the heads of the residents and exterminations of entire civilian families. However, medical supplies and electricity were prevented from entering into the Gaza Strip. Sometimes they also used to use destructive explosive missiles without voice. Till now, they were killed approximately 230 person here. I wish you can watch and read more about that. Finally, thanks to all of you for attending me, and thanks again for the word of optometry. If there are any questions, let me know, please. Again, wishing to see you again in the future. Thanks again.